Dr. Mary Fox is the Chief Medical Officer for the Visiting Nurse Association of Greater St. Louis. This is your busy season. Thank you so much for making time to come here to talk to us about flu. Why is the flu season off to such a fast and furious start?
Well, as you mentioned, we have one strain of the flu, H3N2, which is an influenza A, which is only 10% effective. And for that reason, there are people that are coming down with more serious cases of that. However, you have to keep in mind that the flu shot has several other strains in it, 2 if you take the trivalent and 3 if you have a quadrivalent, and those are actually as effective as they ever have been and possibly even more effective. So you're getting more than just the 10% ineffective vaccine for the H3N2.
Usually we associate flu with bitter cold temperatures, and now we're seeing in a relatively mild winter these numbers of people with the flu. That seems unusual.
It is unusual, and it basically stems from the fact of the the mutation of the H3N2 virus.
Okay, so it changed just a little bit and is not that perfect match with the flu shot? Is that what you're saying?
That's correct, yes.
All right, I also want to make the distinction, Dr. Fox, about the exact disease we're talking about. This is true influenza,
right,
which is different from stomach flu, correct?
Yes.
Tell me the difference.
Well, influenza A is the one that most people are experiencing symptoms from who do come down with it, and that is a very serious type of flu. You get high fevers, you get chills, you feel like a truck has run over you. You usually have a cough, sometimes a sore throat, often a headache. So it's something that you just feel terrible when you get this. As opposed to people who say they have the stomach flu, that typically is just nausea, sometimes with some vomiting and diarrhea, and that is not the type of flu that we're dealing with.
And there is no shot that protects you against that.
That's correct.
So you're still recommending people get the flu shot for influenza even though it's not the perfect match, right?
That's right. It's better to have some protection than no protection, and especially for those people who are very vulnerable, small children, seniors, pregnant women. By other people getting the flu shot, you help decrease their exposure, and that's always a good thing.
All right, Dr. Mary Fox with the Visiting Nurse Association, thank you so much for joining us. And there's so much flu vaccine out there. You can call your doctor's office or the Visiting Nurse Association at the number on your screen, 314-918-7171.